Good afternoon, everyone. My name is Anna Galazka, and I am a lecturer in Management, Employment and Organisation at Cardiff Business School. I was very much looking forward to coming to the conference and speaking to you in person about the research that I have done in the Lindsay Leg Clubs, exploring the value of social models of care in wound care. But as luck would have it, I tested positive for COVID on Monday and am therefore unable to join you in person. The great team behind the conference has kindly agreed that I record my presentation ahead of my scheduled slot, and I do hope that some of you have stayed until the very last part of the conference, but definitely not the least important one, to hear about the work that I have done into social models of care. I'll be drawing in my presentation predominantly on the work that I have done with the Lindsay Leg Clubs, but you will hear references to me talking about my earlier doctoral work in wound care. I hope that you enjoy the presentation, and I wish I was there in person to have a chat with you about my research. But please remember, you can always contact me on my email, and I do hope that next year nothing will stand in the way of me talking about my work to you in person and enjoying the wonderful conference that Ellie and Lynn and the whole team behind have put together. Looking through the keyhole, exploring social models of care in addressing social isolation. When I was teaching my master students earlier this term, I told them that when preparing academic discourses, be it presentations or pieces of written work, it's really important to set the hook, to get your audience interested, captivated by what it is that you are about to tell them. Here is my hook, prepared kindly by Graham, Ellie, Lynn, and the wonderful, wonderful Leg Club volunteers and Leg Club members, Leg Club nurses, who kindly contributed their insights into what is a lovely video that I will try to live up to with my qualitative exploration right after. Enjoy the video.
Hello, my name is Celia. I've been coming to the Leg Club for quite a few years with mainly swollen legs and the occasional injury that they've helped to prevent them becoming an ulcer. It's a wonderful place here where they sort you out, and you have a wonderful social life.
Hi, my name's Brenda and I work at the Leg Club. I've worked here since it started 7 or 8 years ago. I've seen it grow from being a tiny little leg club into a really full-functioning leg club now. I love the fact that we get people come in that don't go out of the house and refuse to come when they started to come, but now have become volunteers or they got involved with social activities, and it's changed their life. It's been life-changing for a lot of people. We've healed legs which weren't healing in surgery by the team getting together, and it's a real teamwork here. You're drawing on lots and lots of people's energies and experience. But yeah, I love it.
Hi there, I'm Alex. I've been coming to the Leg Club on and off now for 3 years. So handy to have because at the minute it's so hard to get into the doctors. They treat me well and they make my legs better.
Hello, my name is Sue. I have volunteered for 6 months at the Leg Club. I love it, I love the people, and I love helping people.
Hi, my name's Sheila, and I've been here for 7 years now. This is my lifeline. I love the people, I love the patients, I love the camaraderie amongst the volunteers, and we have a great time.
Hi, my name's Lissy. I've worked in the Leg Club at Bedford Forward since it started. I've just recently qualified as a registered nurse, and I used part of my training with the Leg Club been my modules that I had to work towards. I actually did very well in that module because it's such an amazing place to work and with so much opportunity for the members of the club and also the staff that work here.
Morning, guys. All right? Yeah, well, the offer is there.
I'm Pat. I go to the Upton Leg Club every Thursday. I've had a very bad ulcer on my leg, and thanks to the nurses, it's healed. They've always been brilliant, warm and nice, caring, and I am very, very grateful to them all.
Hi, my name's Pauline. I've worked for the Adam practice for the last 22 years. I'm a healthcare assistant, semi-retired. I've been supporting the Leg Club for the last few months, meeting and greeting the members and making sure they have everything they need, as well as liaising with the volunteers and the nursing staff.
Hi, my name is Keith. I come to the Leg Club not just to see the wonderful nurses, but the social side of it as well. Everybody feels welcomed and well looked after. I wouldn't change it. I've been coming for 15 months and is looking to come for another 15 months, just to the social side. The Leg Club is such a wonderful place to be.
Well, I hope you enjoyed the video as much as I did when I first watched it. And here is just a handful of quotes. It's a wonderful place where you have a wonderful social life. It's been life-changing for a lot of people. I love helping people. It's my lifeline. The social side of it, everybody feels welcome. So I think with all these quotes that summarize the value of social models of care in addressing social isolation, we now need to dig a little deeper and ask ourselves a question: what must the world be like for all these quotes for this to be the case? And let me guide you through what I learned about what this world is like and what social models of care can do to address it. The huge scale of medical advances has meant that people, on average, live longer, but medical advances have not yet found a way of curing all chronic conditions. Some of these chronic conditions can cause pain, can cause a decline in mobility, and a withdrawal for individuals who experience those conditions from social life. I think we all know someone in our family who suffers from a chronic condition, as a result of which they've not been able to participate in the social life as much as they used to before the condition hit their life. On the media, we have heard people talk about loneliness as a modern epidemic, something that was making the headline even long before COVID-19. But after COVID, that sense of isolation, loneliness has increased, especially for older individuals who have been encouraged to stay at home to protect their physical health. Research on work and society has examined the influence of long-term illnesses on our societal functioning and what people can do about it. There have been abundant publications on the influence of diabetes in our social life, arthritis, or long-term mental health conditions. But wounds as a chronic condition remain relatively poorly recognized in the context of exploring their contribution or their influence on the societal functioning of individuals who live with chronic wounds. The thing about wounds, in addition to the pain that I've just referred to, the decline in mobility, their withdrawal from social life, is that they attract a sense of social stigma that's to do with the way that wounds look or the way that wounds smell. On this slide, I just wanted to share with you a couple of quotes that I've gathered throughout my research in the context of wound care, both in specialist outpatient wound healing clinics during my PhD, but also in my postdoctoral research into social models of care in wound care, which I conducted during my postdoc. So the first quote draws our attention to a situation experienced by one elderly patient who said that her daughter and granddaughter would no longer visit her as much as they used to because they could not stand the smell from the wound. In a similar situation, as I later learned from a member in one of the leg clubs, when his grandson used to visit, he would ask about the smell, and the said member had to lie to his grandson and tell him that the smell was coming from the pipes. Now, how heartbreaking this is for the individuals affected, and how heartbreaking this is for the family. And I think we can understand how the sense of social isolation and loneliness is embedded in the very complex experience of having a chronic wound. In addition to dealing with unpleasant physical symptoms, there are the familial and societal repercussions of living with wounds. So, where do social models of care step in? Leg clubs, as a social model of care, can help tackle loneliness and they can help tackle social isolation. And this was recognized before the COVID pandemic, but also acknowledged after the COVID pandemic started, when the leg clubs began to reopen their doors to adjust to the post-COVID world and to find new ways of operating safely. Leg clubs enable individuals to form meaningful social relationships. They are a key component of the quality of life because they affect how we feel in our circles, because they affect our mental health, our health behaviors, our physical health. They can reduce our mortality risk, and they can help reduce loneliness and social isolation amongst older adults. Leg clubs do generate all these positive social outcomes, as the publications that I've consulted have abundantly told us. But what exactly are these social outcomes, and how do these social outcomes exactly bring about that sense of social value? What is the evidence behind the claim that leg clubs generate social value, and what can we do as supporters of the leg club environment to capitalize, to build on the leg club potential to generate that social value? Here are a few words about the service evaluation from which the majority of my findings in my presentation today come. And before I start talking about the service evaluation, I just want to say a huge thank you to the individuals and organizations that supported me in undertaking this research. And that's the funder for the project, Molinsky Healthcare. I was working on the service evaluation through collaborating with the Welshwood Innovation Centre as a Cardiff University academic. And of course, it goes without saying, a huge thank you to the Lindsay Leg Clubs, to Ellie Lindsay for letting me into her world, letting in a researcher she didn't know, and letting that researcher explore the value of social models of care. The service evaluation was a light ethnographic study, which I undertook to demonstrate how value is created in the space of the social interaction within the Lindsay Leg Clubs, the social interactions between members, volunteers, and to some extent, the medical personnel within the leg clubs. Data collection ran between the 1st of October 2019 and the 15th of January 2020, and I involved 6 UK leg clubs in this study who ever so generously let me into their worlds. I undertook about 54 hours of observation in these 6 leg clubs, and I held plentiful informal conversations with members, with volunteers, with nurses, while watching the leg clubs operate. And on top of those informal conversations, I also had a range of more formal chats with volunteers and members, which I took a note of in my notebook so that the quotes that I'll be sharing with you today that demonstrate the value of social models of care in addressing social isolation are paraphrase expressions of those members and volunteers and healthcare professionals that I had the absolute pleasure to speak to during my research. The three specific dimensions of my findings that I believe speak most strongly to this idea of how leg clubs and social models of care more widely can help address social isolation are the possibility, the ability, the potential of social models of care, such as the Lindsay Leg Clubs, to create a sense of community amongst the individuals who attend the leg clubs, who make the leg clubs, who own the leg club. On top of that, it's about fostering a sense of collective learning so that those who attend the leg club can learn from each other. And that means that they feel a lot more confident and a lot more prepared to tackle the issues that their wounds might throw at them, so that they feel more confident about going out rather than closing in on themselves. And finally, leg clubs have got the ability to offer older individuals who volunteer for them avenues for continued societal functioning, avenues for building on or capitalizing on the professional potential that they had when they worked, so that that potential is put to the best possible use and to the betterment of the condition of members and other volunteers in the leg clubs. First of all, the key theme that was dominant through the conversations that I was having with members and volunteers in the leg clubs was that leg club attendance was predominantly a social occasion. As is captured in this quote here, I enjoy the social side of things. I enjoy having a cup of tea and a cake and also just having someone to talk to. It's terrific. I wouldn't change anything about it. Members also praised the fact that leg clubs would happen in non-medical spaces, that they were happening in community hubs that were not healthcare places that can be a little stressful for some, but it was a community. And this is very well captured in this quote from a female member. There's a lot of benefit to be taken from the fact that it does not happen in a surgical environment, but that it happens in a community club, that it is in a community. Of course, I recognize, and it was also recognized by the members that I have spoken to, that leg clubs were a social opportunity for many, but not for all. So let's have a look at this quote from one male member who was aged 43 and who told me, in a very reflexive way, that he realized that for older people, the interactive social side might be very important and the only way to have a social side to their life. For someone my age, 43, I have a varied social life anyway, but some people who are not as mobile as me might indeed only have this. Another important dimension of creating that sense of community was very much connected to the well-leg program that leg clubs run. What this means is that individuals who do not have a wound anymore, who don't have a wound at all, can still attend the leg club to have their legs washed and creamed, or just to have a space in which they can create connections with other individuals who might find themselves in the same space in life, at the same level as they are. So here is a quote from a chair of one of the leg clubs that I was researching in, who said, "Look at this lady here," and she was pointing at a lovely female member in one of the leg clubs, in her leg club. "She has nothing wrong with her legs, but she lives alone and in a remote area, so she is here every week to have her legs washed and creamed and checked." And that same member that the chair was referring to explained to me later, "They are all so good here," she said. "You come in, by the time you've sat down, the helpers, meaning the volunteers, will give you a tea and coffee. They will I will always put some money in. That's for tea and coffee, because as you know, in leg clubs, sometimes there are charity donation boxes on tables, and people are encouraged to put in a symbolic donation for the tea and the coffee that they had. But that particular member wouldn't put £1 in, but £2, so a bit more, because they're also good here. And I will have some cake and fruit to take home. What's also very important is the physical layout of the leg clubs, because this particular layout very much encourages having those inclusive conversations. It's a flexible open space in which people are encouraged by default to face each other, and that physical arrangement of bodies in the leg club encourages conversations between individuals in the leg club. So it's a little harder to look at the wall as we sometimes do in hospitals or in surgeries where we await our appointment. We face each other, and that means that we are socially encouraged to start a conversation with others and find points of connection, make friendships. The quote here from a member, which I overheard when I was sitting in on one of the leg clubs, suggests how that develops. So one member asked another male member where he was getting his haircuts from, and it turned out that his barber was on the same street where this other leg club member lived. So they invited you. They made a connection, and one of the leg club members invited the other one to give him a ring next time he's there to get his haircut, encouraging him to come in for a cup of tea, and therefore to meet outside of the leg clubs. So the physical setup of the leg clubs was encouraging people to build connections, not just within the realm of the leg club, but also outside. And isn't that just wonderful? Secondly, leg clubs were hubs of collective learning about the preservation of health, not just physical health, but also mental health. The members that I spoke to very much appreciated the fact that there was a possibility to attend the leg club on a drop-in basis without having to make an appointment. They valued this because that gave them speedy access to medical understanding of what was going on with their bodies, but also skills to perhaps intervene the next time a similar situation arose without feeling inadequate, without feeling like they didn't know what they were doing, without closing in on themselves. So let's just have a look together at this field note that I gathered in one of the leg clubs, or in two leg clubs really, for a conversation with a single member who told me in leg club 3 that there's always room for him to learn from the nurses. For example, the iodine that he was given for his wounds made his skin sting. He therefore bought a tub of an antiseptic cream over a counter and brought it here to the leg club to show the nurses, to ask if he could use it instead. The nurse responded by saying that the cream was good for cuts and grazes and that he should perhaps keep the cream for that. But a couple of days later, I met that very same member again, and in another leg club, because he was attending the leg clubs in his locality, and he actually waved me over himself. So he told me to go up to him, and of course I asked him how he was doing, how his leg was going, and he told me that he was silly, that's his words, yesterday morning. He didn't put on the shower sleeve properly, and he got his dressing wet. Fortunately, he had been to the doctors and he had had the right type of dressing at home, so his mother was able to change it for him. But he said he also noticed that his toes were bleeding a little more than usual, and that there was a lot of dry blood collecting in his dressing. So he said he came with a few questions for the nurses because he didn't want to just have his dressing changed. He actually wanted to be shown clearly what to do so that he would be able to do it himself. And having that access to the specialist medical advice as and when it was needed was very empowering for individuals who didn't just have to be passive and wait for their dressings to be changed, but could actually learn actively how to look after their own health. And of course, another important and related dimension to that sense of fostering collective learning is that within the leg club environment, nurses can spend more time with their patients than they can within surgeries, where sometimes the pressure of work is such that they might be given 10 minutes to spend with a patient, and they have to attend to a variety of different patients with a variety of different conditions. But in the leg club, nurses just do wounds and they just look after legs, which gives them a sense of focus and a sense of concentration. And as that nurse, whose lovely quote I captured in my field note says, at the surgery you can only spend 15 minutes, which is often not enough. In the leg clubs, the nurses aim to spend about 30 minutes with each patient, but sometimes they spend a lot longer. So they could care for patients' legs, but they also had the time and the space to deliver holistic, person-centered care, not just patient-centered care, but actually person-centered care, to get to know the individuals, to ask how things were going, to provide that holistic attendance to their wider needs, and that encouraged patients. It made them feel welcome, it made them feel wanted and appreciated, and that improved how they felt, how they went about their daily life. And finally, leg clubs, I discovered, were a fantastic space to give older individuals, very often retired individuals, an opportunity to continue functioning in the society in the professional capacity that they had before retiring, if that's what they wanted to do, or a space to explore other things that they wanted to do, but perhaps they couldn't in their professional capacity. So here in this quote, a leg club volunteer tells me, what would I do then if I wasn't needed? We get something out of it too. I stopped working 18 months ago, but didn't want to stay at home. I didn't want to take up a full-time job either. So I got involved in the leg club because it gets me out of the house and because it means I am doing something for other people rather than sitting at home and doing things for myself. Volunteers were encouraged to set up and run their leg clubs. They were encouraged to contribute to fundraising, and the most common technique for fundraising, or one that perhaps was most visible rather, were the donation boxes on the table that people were encouraged to put donations in for tea and coffee and refreshments. But also very often I saw raffles and tombolas, and of course lots and lots of volunteers did things outside of the leg clubs. They did parachute jumps, they did walks, they did runs. They gave a lot of time and a lot of attention to making sure that they could put their hobbies and their skills into a good cause, towards a good cause, to generate funds to run their leg club. Volunteers who had experience with applying for funds in their professional capacity could write funding bids. Volunteers who worked in for the council or for citizens' advice and advise people on benefits could continue to do so. Volunteers who sadly lost a family member to an illness could encourage greater awareness of conditions amongst other members, not provide medical advice, but just encourage awareness of medical conditions to self-check. So volunteers really had a space to do what they did well. And in one of the leg clubs, volunteers who had worked in healthcare but retired, or who had worked as nurses but retired, could actually come back and work in a clinical capacity by helping members who are going to see a nurse with undressing and washing their legs and preparing the legs for treatment. So there are spaces within the leg clubs for volunteers to continue doing what they loved professionally and to get better professionally at what they were doing. And this lovely quote that I put at the bottom of my slide comes from a gentleman who worked as a graphic designer in his pre-retirement life. The leg clubs were looking to invite members and volunteers in designing and creating their own leg clubs. And that particular gentleman was encouraged to design a logo for his leg club. A logo that would capture the local geographical sites and the community values of an area where the leg club was based. And as he told me, as we were finishing our conversation, if I can help somebody as I journey on, then my living is not in vain. There was something very unique about Leg Club volunteering that I felt I still needed to explore a bit more when I was finishing my Leg Club service evaluation. So what is Leg Club volunteering? What's so unique about it? Well, Leg Club volunteering is about promoting that long-term social health, long-term well-being through developing a sense of community among a disadvantaged population of older adults with leg problems. As Ellie herself told me in a conversation that we were having on a Zoom or Teams, volunteers are the ethos of the leg clubs. But I noticed that comparatively less research has been given to leg club volunteers in the nursing and medical and healthcare publications and social scientific publications that focused on leg clubs as an empirical case study. And there was my opportunity to go back to those leg clubs that I developed a close relationship with and learn a bit more about them. So in the spring and summer 2022, I did a study into Lindsay Leg Club volunteering. It was an exploratory study funded by the Cardiff Business School SeedCon funding. I wanted to understand in particular what motivated volunteers to join the leg clubs, what sustained them throughout the suspension of the leg club operations during the COVID-19 related changes and COVID-19 related closures, but also to try and understand what the future needs of leg club volunteers might be as the leg clubs are readjusting into the post-COVID world. So this was again a qualitative study because I am a qualitative researcher who isn't very good with numbers, but also because I strongly believe in the value of qualitative research, open-ended conversations with individuals about phenomena that matter to them. I think that these ways of exploring social value or any value of any service are the best because they give space for individuals to tell us in their own words what they value, what things mean to them, what things motivate them. So it was a qualitative piece of work that used semi-structured interviews. I returned to two of the leg clubs that I had spoken to in my postdoctoral service evaluation, but I also had the absolute pleasure of exploring or expanding my research to another leg club, a new leg club that only started operating in January 2020, and therefore wasn't really going on for too long before COVID meant that they had to close down for a bit. So altogether, I conducted 16 interviews with 16 volunteers, 4 in Leg Club 1, 6 in Leg Club 2, and 6 in Leg Club 3. And the research happened between May and August 2022. Now, a bit of shameless self-promotion. I have already managed to publish my findings, some of my findings, in a journal. I'm providing a reference on the slide for those who would like to take a look. But I understand we're all busy professionals with very little time to read all the latest research. So I'm hoping that with the next couple of slides, I can give you a good outline of what I learned and what I discovered about Lindsay Leg Club volunteers. So I said I wanted to understand 3 things: their motivations, their experiences, and their ideas for the challenges ahead. So in terms of motivations, I observed that very often, Leg Club volunteers would either start as members or as companions, attending to provide company for their members who perhaps were a bit shy at first or unsure or had mobility issues, which meant that they had to be brought to the Leg Club by somebody. So here one volunteer told me, I started as a patient coming for a doctor, and then from then on, I've been coming every week. But of course, not all volunteers started as members. Another big group of volunteers, another theme that captured the motivations behind joining, was that Leg Club volunteering was driven by the desire of retired individuals with a strong sense of purpose to give back to the community. So as volunteer 14 from Leg Club 3 told me, I'm a member of another charity, and one of our members was saying that the Leg Club was looking for additional people to get involved with transporting people, and I thought that was something that I could do. I retired, I'm not working, and I'm involved with a number of charity things through the bigger charity that I anonymized for the purpose of this publication. And this was one of the things that I thought was relatively straightforward for me to do, and I could help people by bringing them to the Leg Club. Now, the third set of factors that encouraged individuals to join were, as I broadly name them here, emotional, social, and mental health reasons. So sometimes people who started to volunteer for the Leg Clubs were themselves experiencing challenges on an emotional and mental health level. Perhaps they had just lost a family member. Perhaps they were struggling with depression as a result of a series of heartbreaking, heart-shattering losses within a short space of time. They needed something to do. They needed somewhere to be. They needed to give themselves to other people to cure their own ailments. And that's what some of the volunteers did. As the volunteer whom I'm quoting here on the bottom of the slide said, the girls were so kind to me, and that was the positive thing that I had, something positive, the positive feeling that I had in the week. About the experiences of being a Leg Club volunteer? Well, first of all, and that was pretty obvious from what all the volunteers were saying to me, there was an enormous sense of satisfaction from giving yourself to others. That sense of satisfaction came from offering small acts of kindness to other people, from serving a cup of tea to sitting down to chat with somebody, helping somebody stand up, singing a little song with somebody, or helping somebody win a tombola. In addition to those small acts of kindness, enormous satisfaction came from providing material assistance to Leg Club members. And I particularly remember in this one Leg Club, the new one that only started in January 2020, volunteers would put some money together, money that they would perhaps get through either donations or encouraging other organizations in the locality to make those donations. And they would put them together and donate them to individuals who needed that material assistance. So there was an individual with a mobility scooter who was attending the Leg Club that needed batteries that he couldn't quite afford the money for. So they put together a pot of money to fund the batteries and to fund the cover to protect that individual from the rain. Or things such as food vouchers for individuals who are struggling to be able to go to the supermarket and buy themselves some fresh food. So that was very much about not just looking after people in the Leg Clubs, but also giving them help and assistance outside of the Leg Clubs through the resources that they could pull together within the Leg Club. And there was a great sense of satisfaction from being somebody's lifeline of social support. As Volunteer 7 from Leg Club 2 said, I just love helping other people. I love helping other people, absolutely. Another important dimension of attending the Leg Club as a volunteer, another important experience of volunteering was about building those meaningful connections. So a volunteer in Leg Club 3 told me, I do love being with people. I'm not really a house person. I love to be outside to meet people all the time. And I get that. Some of us get their energy from being around people. I'm also one of those individuals. Being able to spend your mornings, one morning a week, with other people in flesh after months of years of COVID-19 and imposed isolation was refreshing, and it enabled individuals to form friendships with those whom they met in the Leg Clubs. But of course, and I really want to stress that, it was also about that personal growth. Being able to, or having to, push yourself, step out of your comfort zone, go to the Leg Club and put yourself out there. Be responsible to somebody else. Had a tremendously positive effect on the sense of confidence and well-being of those volunteers who are giving themselves to other people. Those volunteers who were originally quite shy and not very social observed the change in how they were when interacting with other people. So being able to give yourself to other people was also an opportunity for them to experience that personal growth. I was never very outgoing before I came here, but she has grown immensely. Talking to them, talking to members, has meant that she has grown immensely. And finally, what about the objectives that Leg Club volunteers saw as important for the future? So in my previous 2 slides, I very much focused on themes which I saw replicated across the Leg Clubs. But here on this slide, I would like to focus on the one objective that was so very common to all the Leg Clubs that I spoke to, and that was the need to recruit more volunteers in order to be able for the Leg Clubs to resume their pre-pandemic levels of activity in the social areas. So it was about that desire to recruit more volunteers. The lack of volunteers is what we need. We need more volunteers said to volunteer in Leg Club too. Quite a few volunteers left, unfortunately, and that was during COVID or as a result of COVID. But as Leg Clubs are reopening their doors, more and more people are coming back. So Leg Clubs do need a bigger number of people to be able to run the Leg Clubs. The new normal, the post-pandemic new normal, where we are a bit more cautious about being around other people. Naturally, with me recording this from home, one example of that means that we unfortunately maybe have less spaces for that unencumbered social interaction. So people's behaviors have changed, but people's needs for social contact haven't. And all Leg Clubs recognized that there was a need for more volunteers. There was a need for more people to help get people to the Leg Clubs. And I just want to end my slide here with one quote from one volunteer who emphasizes, who stresses, who illustrates what Ellie said earlier to me in a conversation on Zoom or Teams, that volunteers are the ethos of the Leg Club. So this particular volunteer said to me, "I think without us this wouldn't function." So just to summarize, no man is an island, might be a cliche, but Lindsay Leg Clubs, as a social model of care, have a transformative potential to bring people together, to heal better by making friends, by learning from one another, by being motivated by peer pressure in the company of nurses to engage in positive health behaviors. Not just positive physical health behaviors, but also positive social health behaviors. Thank you very, very much for listening to my presentation today. I only wish I could have done it in person. I am wishing you all safe travels back home, and I hope that next year we will meet again and meet in person. Thank you again. Take care and goodbye.